So antibiotics that destroy membrane integrity. Now remember, human cells have membranes. Bacteria cells have membranes and cell walls. Human cells do not have cell walls. So we can target an antibiotic that destroys cell walls, we're in good shape. And that's basically what we've done. Okay, so age of antibiotics began in 1927. Alexander Fleming, by accident, discovered penicillin, that the mold penicillium could kill susceptible bacteria. Okay, we know that penicillin inhibits bacterial growth by interfering with the cell wall synthesis. So it can't make the cell wall, puts holes in the cell wall leaks, bacteria die, human cells are not affected by it. That's the ideal magic bullet. Okay. Since then, hundreds of antibiotics, which are microbial products, that either kill or inhibit the growth of susceptible bacteria or fungi, have been discovered. We've come a long way since 1927. So the key to antibiotic therapy is to find a target in the microbe, in the pathogen, a metabolic process or structure that humans don't have. Because ideally, you want to kill bacteria cells or your pathogen or your virus and not touch the human cells. In an ideal world, that's what happens. So in this way, the antibiotic will selectively inhibit the disease-causing organisms without harming the patient. But we all know everything has side effects, no matter what it is. Everything's got some kind of side effect. So many antibiotics disrupt cell membranes. Okay? The cell membrane is not an ideal target for antibiotic therapy because human cells and bacterial cells have cell membranes. So you have to be very careful. You don't want to inhibit or break apart the human cell membranes at the same time you're killing the bacteria. So therefore, both types of cells are damaged. Because these antibiotics exist a wide range of toxic side effects. When ingested, they're usually used to combat infections topically on your body surfaces. So the ones that damage cell walls we usually use as topical antibiotics. Okay. In this way, damage to the host is minimized, but the inhibitory effect on the microbe is maximized. So polymyxins are antibiotics produced by the bacterium Bacillus polymyxa. Okay. They are protein derivatives having one end that is hydrophobic because of attached fatty acid. Remember the fatty acid chains that attach, like triglycerides? Hydrophobic portion dissolve in a hydrophobic solution. The opposite end is hydrophilic, water-loving. It's polar. Okay, because of these properties, the polymyxins bind to membranes with a hydrophobic end, and it comes embedded in the membrane. Remember, membranes are bilipid layer, polar on the outside, hydrophobic on the inside, long-chain fatty acids. So these polymyxins can bind to the membranes inside the membrane structure, inside the hydrophobic portion, while the hydrophilic ends could remain outside the cell. Okay, so as a result, the integrity of the membrane is disrupted, and you get leakage of cellular constituents occur, causing cell death, because it basically puts a hole in the cell wall and the cell membrane by disrupting it. You can see how it disrupts it here. You can see this is the hydrophobic region right here. My red pen back. Okay, so when these polymyxins get in here, the hydrophobin bonds inside of here and disrupts this membrane and causes this membrane to leak out and basically kills the cell. And it goes into different areas there. Okay. So although the polymyxins have been found to be useful in treating some urinary tract infections, pneumonias, and infections of burn patients, other antibiotics are not favored because of the toxic effects of the polymyxins on the kidney and central nervous system. So you gotta be careful. They're gonna affect, like I said, all medications have side effects. Be very careful what those side effects are. So polymyxin B is still used topically and is available as over-the-counter ointment in combination with other antibiotics, neomycin and bacitracin. That is polymyxin B. Okay. It's a hydrophilic end. The hydrophobic end bonds into the cell membrane, causes the drift of the cell membrane to leak, causing cell death. Okay. It's toxic to the central nervous system and to the kidney. That's why I'm using it as topical. Okay. Two other antibiotics that destroy cell membranes, amphotericin B and nystatin, are large ring structures used in treating serious systemic fungal infections. That's used for fungal infections. These antibiotics are complexes with ergosterol in the fungal cell membrane and disrupt the membrane permeability, causes leakage of the cellular constants. This works the same way. We use nystatin for trench mouth, yeast infections in the mouth. We'll use nystatin for that treatment. We'll use the rinse. Neither is useful in treating bacterial infections because most bacteria have no ergosterol in their membrane. So those are antifungal drugs. Okay, nystatin and amphotericin B are only for antifungal because they don't have ergosterol in the membranes of bacteria, only in the fungi. Okay, that's why you can use it for fungal infections. So both amphotericin B and nystatin are extremely toxic, cause symptoms that include nausea, vomiting, fever, chills, anemia, and renal failure. So you have to be careful where you use it and how you use it. Okay. It's easy to understand why these drugs have restricted treatment of life-threatening fungal diseases. And this is what they look like. This is amphotericin B, these long chain fatty acid here. That is your hydrophobic part. That dissolves in the cell membrane. This right here, look at all those OH groups. OH groups are polar. Remember, they catch the hydrogen bonding, so it allows you to dissolve in water. So this part dissolves in the membrane. This part sticks out. This allows you to put a hole basically through the membrane and kill the antifungal. That's the aerosterol background. Nystatin's the same way. Here's your hydrophobic part that binds into the membrane where it's hydrophobic, and this sticks out of the membrane because this is polar. Okay, so those OH groups are all polar. Okay? So again, it allows the same disruption of that cell membrane and causes it to leak.